episode, we are going to talk about the epidemiological approach. How does the epidemiologist proceed to identify the cause of the disease? Epidemiological reasoning is a multi-step process. Step 1. Determine whether an association exists between exposure and the development of the outcome in question. In epidemiology, exposure refers to the causal factors that may be associated with the disease. For example, contact with a biologic agent, harmful materials, characteristics such as age or blood type. Outcome refers to the disease or other changes in health status. Not all the association we observed is causal relationship. So step 2 is trying to derive appropriate inferences about a possible causal relationship from the patterns of the associations that have been found. Epidemiology study often begins with descriptive data. Generally, we describe illness or disease in terms of person, place, and time. That is the three dimension of distribution. Who develops the disease? Where does the disease occur? When does the disease occur? Usually, the distribution can give us some clues of the cause of these diseases. Descriptive epidemiology is concerned with the variation of morbidity and mortality of disease in a population, which includes case report, case series, ecological study, and cross-sectional study. Information obtained by descriptive epidemiology is not only useful in healthcare, but also provides clues to the potential cause of disease. Analytic epidemiology is more concerned with the relationship between the exposure and outcomes, including cohort study, case control study, and experimental study. We also can classify epidemiology methods by observational and experimental studies. For observational study, most of the time, epidemiologists just observe and evaluated the occurrence of the disease or other health-related conditions to identify the causal relationship between exposure and outcome. While in experimental study, the interested factors associated with the disease are usually controlled or changed by investigators, which also called it intervention study. Let's take an example. We want to test the efficiency of a medication or vaccine. So at the end, we give a brief summary of all the epidemiology methods we are going to introduce during this course: case report, case series, ecological study, cross-sectional study. They all belong to descriptive study. while case control study, cohort study, experimental study belongs to analytic study. In the other way, case report, case series, ecological study, cross-sectional study, case control study, and cohort study all belong to observational study, which is different from experimental study.